Good morning, everybody. Thank you so much for being here. Welcome to our witnesses. Welcome to our guests joining us in beautiful Oceanside, California in the 49th Congressional District. Without objection, the Chair is authorized to call for a recess at any time. It's with great pride that I'm able to bring the subcommittee I chair for the House Committee on Veterans Affairs to the Veterans Association of North County, also known as VANCE. I thank Chairman Takano and Ranking Member Moore for joining me here today to participate in this important hearing. Today's hearing is entitled Ending Veteran Hunger, Examining the Impact of COVID-19 on Food Insecurity. Hunger among veterans has long been a priority for me and for this subcommittee. In fact, one of the last hearings that we hosted in person before the onset of the pandemic was on this topic, and we're grateful for the opportunity to receive updates today on how COVID-19 impacted food security for our veterans. In March of 2020, at the start of the pandemic, it was estimated that 1 in 3 people in San Diego were food insecure. Again, 1 in 3 people were food insecure. That's just an incredibly high number. COVID-19 compounded existing financial, physical, and mental hardships for our families. Just a few months into the pandemic, I attended a Memorial Day event just down the street from here in Oceanside, at which Vance distributed food for veterans and military families in need. I saw the long line of cars that were filled with families waiting for their turn to receive food. It was absolutely heartbreaking. We didn't know then how long this pandemic was going to last, but we knew that the food insecurity crisis in this country was real and demanded significant action. In response, Congress approved significant pieces of relief legislation. For example, the CARES Act, Coronavirus Aid, Relief, and Economic Security Act, included nearly $500 billion in direct income transfers to families across the country to help them weather the uncertainty and strain that many felt in the early months of the pandemic. The American Rescue Plan included a $12 billion investment in key food assistance programs and expanded unemployment benefits and the child tax credit to help families who are facing hardship. The Census Bureau reported that poverty in the United States actually fell in 2020 due to this assistance. However, many people remain out of work and unable to pay for necessities like rent and food. Before the pandemic, and still now today, veteran families of color are experiencing disproportionately higher rates of hunger. This committee remains committed to addressing these issues. This hearing will examine programs through the U.S. Department of Veterans Affairs and Department of Agriculture that identify veterans experiencing food insecurity and connect them with stable nutrition resources. And I thank everybody here who's doing that work every day. We'll hear about the emerging data from VA and the research from USDA on the prevalence of hunger among our veterans. One USDA study conducted by one of our witnesses here today, Mr. Matthew Rabbit, examined food insecurity among working-age veterans. This research indicated that between 2015 and 2019, 11.1% of working-age veterans lived in a food-insecure household, meaning they were unable to acquire adequate food due to insufficient money and resources. 5.3% lived in a household with very low food security, meaning they were food insecure to the extent that eating patterns were disrupted and food intake reduced. However, VA data paints a different picture. In 2017, VA implemented a clinical reminder that prompts healthcare providers to screen all veterans who receive care at a VA facility for hunger. This is a critical tool for identifying food insecure veterans and connecting them to the nutrition resources they need. And in early 2020, VA testified before this subcommittee that almost 94,000 of the 6 million veterans they had screened since the inception of the clinical reminder were food insecure. That equates to a roughly 2% rate of food insecurity, which obviously is far less than USDA's 11% estimate. VA did not include updated data in its written testimony regarding outcomes from its clinical reminder tool that has now screened over 10 million veterans for food insecurity, but we're hopeful that we'll get an update on that data here today. Though we're grateful for the research and work done by USDA and VA to understand and alleviate hunger among our veterans, there are gaps and there are inconsistencies in the data and the participation of nutrition assistance programs, and that requires our collective attention. We're hopeful that through continued collaboration at the federal and local levels, USDA and VA will be able to tackle this issue together and ultimately eliminate veteran food insecurity. We'll also hear today from a number of hunger relief organizations, local, right here in San Diego. These groups filled critical gaps throughout the COVID-19 pandemic. They continue to do tremendous work to provide food and other services to the hungry. We hope to hear from him about how increased federal resources during the pandemic affected resource allocation and delivery here on the ground in San Diego County. I'm grateful to every witness and audience member who's joining us here on a Monday morning to discuss this important topic. I'd also be remiss if I didn't note that this September, for the first time in over 50 years, the White House will host a conference on hunger, nutrition, and health. The White House is seeking ideas and experiences from all Americans to inform a national strategy that will be released during this conference. Our committee will be sharing insights from this hearing, but we also encourage everyone watching today to visit whitehouse.gov/Hunger Health Conference. Again, whitehouse.gov/Hunger Health Conference to learn more and get involved. With that, I now recognize my friend, the ranking member, Mr. Moore from Alabama. It's a long way from Alabama, but I'm delighted he's here with us in Oceanside for 5 minutes for his opening statement.
I want to thank all of you for joining us at the field hearing today of the Subcommittee on Economic Opportunities for the U.S. House Committee on Veterans Affairs. My name is Barry Moore, and not only is it my pleasure to serve as a congressman of the 2nd District of Alabama, but to also serve as ranking Republican member on this subcommittee. Before we begin, I want to say what a pleasure it is to be here in Oceanside, to thank my colleague, friend, and chairman of the subcommittee, Congressman Mike Levin, for hosting us today. And I don't talk that funny, just so you guys know. Do I sound like I talk a little funny to you, Mr. Levin?
No.
It's great to work with a thoughtful legislator like Mr. Levin on the continued goal to provide economic opportunities for our veterans. The people of the 49th District are lucky to have him as one of their own. We are here today to discuss the important issues on veterans' hunger. Food security for veterans, as well as all Americans, is an essential component of a stable life. Food insecurity can also be detrimental to a person's mental health. It is important for us to evaluate the way we are providing this security and to ensure that it is being administered in the most effective manner to help those who need it most. We also need to do this in an intelligent manner for American taxpayers as well. SNAP and other assistance programs are vital for veterans and others to have food security. We know the best way to ensure the veterans have food security is to have a strong economy with good paying jobs that pay the bills. Before COVID-19 impacted our economy, President Trump and others built the most robust economy in a generation, and veteran unemployment was at record lows. While veteran unemployment is finally back at pre-pandemic levels, our recovery has been a bit sluggish, and we must do all we can to enact pro-growth policies that will help thousands of veterans who are being hit hard by the rise in prices at the pump and for basic necessities like food. We still know very little about how widespread hunger impacts veterans, so I'm looking forward to hearing more about the VA, the USDA's efforts to notify veterans about the benefits they are eligible for, and more importantly, how we can help veterans reach the stage where such benefits are no longer necessary. I look forward to hearing from our witnesses about what they believe works, what they believe does not work, and how Congress can empower those involved in these programs to ensure that no one who has served our country goes hungry. Once again, I thank Chairman Levin for holding this hearing, and with that, sir, I'll yield back the balance of my time.
I thank the ranking member for his opening statement, and now I'd like to recognize a dear friend and a great leader in the House of Representatives, the chairman of the full House Veterans Affairs Committee, Mark Takano. And I'd be remiss if I didn't mention that hopefully this week, Mr. Chairman, we will be passing some signature legislation honoring our PACT Act, and that is just a tremendous accomplishment for you and for everyone on our committee. So we're grateful to you. Grateful you're here from far off Riverside. And with that, I'll acknowledge you for an opening statement.
Well, thank you. Well, good morning to you, Chairman Levin, and thank you for the invitation to join the Economic Opportunity Subcommittee today in San Diego. And Representative Moore, welcome to Oceanside. Welcome to California. I dressed to make you.
I saw that, sir. I saw that. That's a Southern suit he's wearing, everybody.
And he knows I'm a big fan of a Facebook personality who teaches Southern cooking, and she's in his district.
In my district. We're going to have to go on the show together sometime.
Yeah, we're going to go on the show, and she'll teach us how to make biscuits right out of the bowl. Just know that addressing the issue of veteran hunger is a top priority for this committee and Chairman Levin, and I'm grateful to be here to join this discussion today. Stable access to nutritious food is a foundational element of a person's health. Food insecurity can create or exacerbate other issues and is one of the many contributing factors that has led to increased suicide rates, diabetes, heart disease, and depression. And those who are food insecure are also often financially insecure and must confront difficult choices when deciding between buying adequate food, or paying rent and utilities, or medications. People forced to choose between their health and a home also face an increased chance of illness and may underuse necessary medication or delay medical care. What is particularly concerning is the high rate of food insecurity observed among veterans, especially those experiencing serious mental illnesses. Though these issues and more have been felt for years prior, the COVID-19 pandemic has placed a unique financial, physical, and mental strain on veterans and their families. And throughout the pandemic, many people saw a decrease or loss of income. As is well known, the pandemic caused a decrease or even loss of income altogether for millions of Americans. And although federal relief legislation helped bridge the gap in resources throughout the pandemic, the long-term financial strain for families remains difficult to forecast as some of those measures expire. I commend the hunger relief organizations represented here today for the critical work they do to provide meals and services to those in need. However, if the pandemic has taught us anything, it is that the onus can not only be on the nonprofit sector to help families be healthy and remain healthy, and for those families to be fed during trying times. I look forward to continuing to work with my colleagues in Congress and with the federal agencies to strengthen social support systems to provide equitable, sustainable resources for all Americans to not only live healthily, but to thrive. And I yield back, Mr. Chairman.
Thank you very much, Chairman Takano. That brings us to our witnesses. Grateful you're all here. We have two panels with us today, the first representing federal and local government agencies, and the second made up of some non-governmental organizations. On the first panel today, we have Dr. Christine Going, National Food Security Program Coordinator at VA. Nice to see you. Dr. Going is accompanied by Mr. Daniel Santibanez, Chief of Nutrition and Food Services at the VA San Diego Healthcare Center. Thank you so much. I also want to thank USDA for joining us on this important topic. From USDA's Economic Research Service, we have research economist Matthew Rabbit. Thank you, Dr. Rabbit. We also have Mr. Rick Wani, Director of Independent and Aging Services for the San Diego County Health and Human Services Agency. Good to see you. Thank you. Mr. Wani is accompanied by Mr. Wilfred Quintong, Director of the county's Office of Military and Veterans Affairs. Nice to see you. Thanks so much for joining us this morning. As you know, you'll have 5 minutes for your oral statement, but your full written statement will be added to the record. With that, Dr. Going, you're now recognized for 5 minutes.
Good morning, Chairman Takano, Chairman Levin, and Ranking Member Moore. My name is Dr. Christine Going, and I am the Executive Officer to the Assistant Undersecretary for Health for Clinical Services. Thank you for the opportunity to testify today on the important topic of food insecurity. I am joined by Mr. Daniel Santibanez, the Chief of Nutrition and Food Services for VA San Diego Healthcare System. One food insecure veteran is one too many, and I am excited to share with you what VHA is doing to tackle this issue. In early 2016, Nutrition and Food Services created the Ensuring Veterans Food Security Work Group. You may notice that we use the word security versus insecurity. That was chosen purposefully to remind us of our goal to end veterans' food insecurity. Since inception, the work group has helped increase the spotlight on food insecurity amongst veterans by working in collaboration across disciplines with social work, nursing, primary care, and our external partners. I'm pleased to report that the development of a national program office dedicated to veterans' food security. I have been detailed along with 2 other staff to build this office. The office is focused on 3 pillars: partnerships, data management, and research, and with plans for an interdisciplinary staff. The office will extend and complement the current work group by expanding our current opportunities to spread successful food insecurity practices. Using the core tenet that food is medicine, we help move veterans from food insecurity to food security and eventually nutrition security. Partnerships are critically important to expand the current services offered to the food insecure veterans. One example includes veterans are planned to expand food pantries located on VA facilities. We partner collaboratively with national partners like Feeding America, local VSOs, and then our VA facilities. To increase our understanding of the veterans we serve, the office is focused on the development of data dashboards. We are currently working to capture information on veterans who screen positive for food insecurity, looking at data points like age, diagnosis, period of service, location. This type of data will facilitate a targeted approach to our future practices. The key and strength of our work is in our screening for food insecurity. The new office is focused on screening and intervening, with plans to roll out pilots that look at the value of e-screening as a tool to reach more veterans. COVID-19 impacted food insecurity for many Americans. Since March 2020, VA has completed over 5 million screens. In addition, we directed dietitians to proactively reach out to veterans who had screened positive for food insecurity and connect them with food resources. We have also updated community resource lists that may have either been curtailed or created because of the pandemic. In addition, we have deployed a food insecurity website that includes thrifty meal plans, online cookbooks, simple, inexpensive meal prep, as well as food education handouts, information on SNAP, and links to other resources. In November 2020, VA partnered with USDA, and we provided training to more than 700 VA clinicians titled Make It a SNAP, Screening and Intervention for Food Insecure Veterans. In the summer of 2021, we hosted a virtual conference series for nutrition and food service employees in which medical nutrition therapy for the food insecure veteran was presented. This past March, we partnered again with our USDA and presented a national education training on the different programs within the National Institute of Food and Agriculture, known as NIFA, focusing on GUSNIP grants. Across the enterprise, VA is leveraging partnerships to meet the needs of our veterans. Here in San Diego, the Food Empowerment Program has collaborated with U.S. for Warriors since 2017 to provide more than 220 veterans with a week's supply of non-perishable groceries. As of May, more than 4,500 pounds of groceries have been delivered to veterans in need through this program. The organization is currently on pace to double the number of groceries they've delivered this fiscal year. In partnership with Medi-Cal, VA San Diego has completed 90 CalFresh applications since the Medi-Cal worker began working directly with the VAMC. The money provided through the pandemic funding was incredibly helpful and allowed veterans to balance their basic need of food with other household products and goods like cleaning supplies. Using research conducted by VHA, we analyzed data from the food insecurity screening and found that women, veterans of color, and those with a history of PTSD and other military sexual trauma are particularly high risk for experiencing food insecurity, as well as veterans with other unmet social needs like housing instability. Data from this and other ongoing studies is being used to form and develop tailored interventions to food insecurity. The new VHA Food Security Office is serving to coordinate and communicate efforts across the VA enterprise to maximize our response to veterans experiencing food insecurity. Thank you for the opportunity to testify. My colleague and I are happy to answer questions you may have.
Thank you, Dr. Going. Dr. Rabbit, you're now recognized for 5 minutes.
Thank you, Chairman Takano, Chairman Levin, and Ranking Member Moore. My name is Matthew Rabbit, and I'm a research economist in the Economic Research Service within the U.S. Department of Agriculture. I am pleased to appear before you today to testify about a critical issue facing the nation, the number of food insecure veterans who have limited or uncertain access to food. As the grandson of a veteran, I know the critical importance of keeping our commitment to the men and women who have served our nation. In 2021, I co-authored a report titled Food Insecurity Among Working Age Veterans, which aims to identify the underlying factors associated with veteran food insecurity. The report used nationally representative data to examine the working age veteran population between the years 2005 and 2019. The findings in this report illustrate there is considerable heterogeneity in the risk for food insecurity among the veteran subpopulations and provide new insights into how prior military service may influence food insecurity among veterans. In my testimony before this subcommittee, I will outline the main findings from this report and welcome questions related to our analysis. Between 2005 and 2019, veterans were predicted to be 7.4% more likely to live in food insecure households than non-veterans. There are two plausible explanations for why veteran status is associated with an increased likelihood of exposure to food insecurity. First, veterans use food and nutrition assistance programs at lower rates than non-veterans. Despite higher predicted rates of food insecurity among veterans than non-veterans, according to the Center on Budget and Policy Priorities, only 7% of veterans are estimated to have participated in SNAP between 2016 and 2018, a much lower rate than the non-veteran population. Second, younger veterans are at an increased risk for having a work-limiting disability compared with non-veterans. Given that poor mental and physical health and work-limiting disabilities are associated with greater economic hardship and higher rates of food insecurity, this could explain the increased risk of food insecurity among veterans. While the poverty rate for veterans with a work-limiting disability is higher than the rate for non-veterans, veterans who receive benefits for a service-connected disability from the VA have significantly lower poverty rates compared to non-veterans. In this report, we also use data from the 2015 through 2019 years to examine differences in the prevalence of food insecurity among veteran subpopulations. Our findings highlight the differences in food insecurity risk among veterans, which can be used to better inform USDA and VA's food and nutrition assistance programs in their aim to meet the needs of veterans. Excuse me. Several demographic characteristics known to be associated with food insecurity are considered in this report. Race and ethnicity are associated with food insecurity among veterans. Non-Hispanic Black and Hispanic veterans were more likely to live in food insecure households than non-Hispanic white veterans. However, when comparing veterans and non-veterans, non-Hispanic Black and Hispanic veterans were less likely than similar non-veterans to live in food insecure households. This may suggest service provides veterans from disadvantaged backgrounds with resources necessary for preventing food insecurity. Food insecurity among veterans differed by gender as well. Overall, female veterans were more likely to live in food insecure households than males. Gender differences in the health effects of military service may be leading to higher rates of food insecurity among female veterans. A study by Wilmoth and colleagues found that female veterans were at an increased risk of experiencing a work-limiting disability than comparable male veterans. Veterans receive extensive training due to their military service. These investments in human capital can affect their earnings, which in turn can affect their current and future food insecurity. This is borne out in our report, which shows that veterans were less likely to live in food insecure households as their educational attainment increased. Another factor impacting food insecurity among veterans is their general health and well-being. As military medicine improves, younger veterans are more likely to survive what may have been previously mortal wounds in combat. This is a clear success of modern medicine, but is also tied to higher rates of service-connected disabilities among younger veterans. While we cannot identify veterans with service-connected disabilities in our report, we can identify those with a work-limiting disability. In 2015 through 19, 33.6% of veterans with a work-limiting disability were living in food insecure households, and that was statistically similar to the rate for non-veterans with a work-limiting disability, suggesting veterans with work-limiting disabilities are no more protected from food insecurity than non-veterans with disabilities. Finally, we consider how prevalence of food insecurity among veterans varied by their geographic location. Non-metropolitan veterans were more likely to live in food insecure households than veterans in metropolitan areas, and those living in suburban areas were more likely to be in food insecure households than veterans living in principal cities. The implications of food insecurity are well documented. When an individual's access to healthy, nutritious food is compromised, they are at greater risk for adverse mental and physical health outcomes. By identifying the root causes of food insecurity among veterans, we can collaborate with our federal partners to mitigate veterans' food insecurity. The USDA and ERS are committed to providing a clear, unbiased data on this important issue to inform policy discussions like the one considered here today. Thank you to the members of the committee and subcommittee. I look forward to working with you as we continue to support VA as well as the men and women who have served our nation.
Thank you, Dr. Rabbit. Mr. Wani, you're now recognized for 5 minutes.
Thank you. Good morning, Chairman Levin, Chairman Takano, and Ranking Member Moore. My name is Rick Wani. I'm the Director of Self-Sufficiency Services with the County of San Diego Health and Human Services Agency. I'm joined this morning by Will Quinton. He is the Director of our County Office of Military and Veteran Affairs and a distinguished veteran himself of the U.S. Navy. I'll be providing our joint testimony this morning. San Diego County is the second largest county in population here in California to more than 3.3 million residents and spans over 4,500 square miles. The county takes pride in its military history and is home to the largest number of military personnel in California, with 16 military installations belonging to the Navy, Marine Corps, and Coast Guard, and located throughout the county where 110,000 active duty military personnel are deployed, in addition with their 118,000 family members and over 240,000 veterans who reside in the county. San Diego County for over 100 years has served as a key location for the military, making it a popular place for many military personnel and veterans to live and retire. As a representative of the County of San Diego, we oversee the public assistance programs on behalf of the state of California. That includes SNAP, Medicaid, and TANF. And in addition to that, we have the County Office of Military and Veteran Affairs. San Diego County is committed to serving veterans by linking them to several essential services and resources, including conducting frequent monthly outreach events, assisting with VA claims, and linking veterans to disability benefits, including monthly compensation and pensions. During this last year, San Diego County linked veterans to disability benefits, which resulted in over $13.6 million. And San Diego County also served veterans through public assistance programs. And currently, we serve over 2,700 known or self-identified veterans in our SNAP program. We are certain that there are many more veterans enrolled in our SNAP or CalFresh known here in California, but they have not self-identified. Food insecurity has been on the rise in the United States and the nation. However, the impact of COVID-19 and the pandemic has been devastating across the region, impacting many populations, including our veterans. During the pandemic, many veterans and military families have become reliant upon alternative resources to supplement their income and food budgets, including utilizing food banks and the SNAP program. During the COVID-19 pandemic, many efforts were made statewide and locally to help supplement food budgets for vulnerable populations, including food boxes, pandemic benefits for school children, COVID stipends, SNAP emergency allotments, and food bank resources. During the COVID-19 pandemic, the county experienced a 40% increase in our SNAP caseload, and enrollment is at an all-time record high with over 360,000 San Diego County residents currently receiving the benefits. Many things can be done to help uplift our veterans, including ensuring that they identify themselves as veterans when applying for programs, so they can be appropriately screened for all services or benefits that they may qualify for. Once an individual is properly identified as a veteran, the county can help them apply for critical services and programs, including SNAP, and addressing any outstanding stigma associated with the receipt of public assistance programs is also critical, and to encourage eligible veterans to not only apply for services, but also to the other benefits they are entitled to. Additional complications, such as the lengthy SNAP application process, interviews, and multiple reporting requirements throughout the year, can also introduce additional barriers to veterans attempting to access the program. Because there are no special waivers or rules for veterans with regards to SNAP eligibility, they are subject to the same stringent guidelines as all other applicants. Implementing processes such as categorical eligibility or express lane enrollment into SNAP could benefit many disadvantaged veterans, as the program is critical to battling and reducing food insecurity. We would like to thank the committee for your time today, and would hope that the committee would consider opportunities to reduce barriers in enrolling or maintaining veterans into the SNAP program to help combat food insecurity, and we are available to answer any questions. Thank you.
Thank you, Mr. Wani, and I appreciate all the collaboration that we have with the County of San Diego and for all the work that you do. With that, I want to recognize myself for 5 minutes to begin the question portion of the hearing. Dr. Going, thank you for your testimony regarding how VA is working to identify and connect veterans experiencing food insecurity with the resources that they need. Can you please provide us with an update on the results of the clinical reminder for food insecurity, and specifically how many veterans have screened positive for hunger since the clinical reminder was implemented? And are you seeing any demographic trends in the data for which our subcommittee should be aware?
Thank you for that question. At this time, we actually are not seeing any change in the percent of veterans that are screening positive. When we reported out to you earlier, we were hovering around the 2% mark, and we continue to score. Our percentages continue to be between 2 and 3% screening positive for food insecurity.
And do you screen for hunger during vaccination appointments?
The screen is required during primary care visits, so that's when it's required, and that's when it will be triggered on an annual basis. If a veteran screens positive, then that will be, the trigger will come back again every 3 months until the veteran screens negative.
But not during a
It's
vaccination
not
appointment?
required during vaccination. It can happen at any time, and it's available for clinicians to do the screen whenever they see a veteran, but it is required in the electronic medical record at the primary care visit.
Do you think it would be a good idea to start screening at vaccination appointments, given that a ton of people are going to be going for a booster shot this winter?
We actually do believe that's one of the goals of the office, is to screen and intervene. So we absolutely want to see an increase in screening. So that is a great possibility.
As I have had conversations with Secretary McDonough about this, I think that 15 minutes where you've got that veteran and they're waiting to be given the all clear to leave the room after they've received a booster shot, you ought to be using that time. You ought to be using that 15 minutes to screen for hunger and whatever else you think is advantageous, all the other services that VA provides. It's a golden opportunity. So I hope that when we speak with you, 6 months, a year from now, that you're doing that. Let me ask this. How many full-time equivalent staff does VA have dedicated to food insecurity at the national level? And who's responsible for developing and implementing national VA policies and procedures related to hunger?
So we have been approved just recently for the development of this office. So the intent is that the office will be staffed with 6 FTE, and it will with a director, a dietitian, a social worker, a nurse, an executive officer who will be responsible for communication, legislative affairs, and a program support assistant. So that is the plan for right now.
I appreciate that very much. We'll look forward to following up and seeing how this evolves. How many, so you said 6 full-time equivalent staff. How many does VA have dedicated to food insecurity at the medical center level across the country? And who's responsible at that level to ensure that veterans who screen positive for hunger are then connected to resources?
There is not dedicated staff at the facility because food insecurity falls under the scope of whole health, and so it's really everybody's responsibility. It starts with primary care, as I mentioned, where you're screened, and then based on the response, if a veteran screens positive, they are immediately offered an appointment with a social worker and/or a dietitian who would then follow up with them. The veteran can choose to be seen at that time, or they can make an appointment at their convenience. And then the follow-up, because we capture that information in the clinical reminder, it's then the responsibility of nutrition and social work who collaboratively work together to track that data.
So just so I'm clear on this, and perhaps Mr. Santibanez, I can ask you. So in our local VA, our Jennifer Moreno VA Medical Center, we have no one on site who's directly responsible for food insecurity?
Good morning, Chairman Levin. Thank you for that
Good morning.
question. At the San Diego healthcare system and at the Jennifer Moreno, we have a group of registered dietitians, and we are all tasked to do comprehensive assessments on every veteran that we assess, and in every assessment we do a whole health, which includes food insecurity.
Okay.
We do have, since 2016, we developed a nurturing aspect of food committee. And that committee has been tasked with education and training to staff, providing awareness. They also coordinate something called the Food Empowerment Program. And so this is something that we have been rolled out since the food insecurity clinical reminder has been out. So while we don't have a dedicated FTE, we have constant education and sharing of resources within social work and nutrition, and it's everyone's job to screen and find resources for our veterans.
But there's no one person that oversees that effort. Do you think it would be helpful to have an FTE with that sole responsibility? I don't want to get you in trouble. I'm asking you personally.
I think coordinating that at an individual level would definitely help. We work throughout our network with the county, with local resources, so perhaps one person could better coordinate that.
Gotcha. I've got some more questions, so why don't we move to the ranking member and the chairman, and then we can do a second round. That sound good?
Yes, sir.
Recognize the ranking member.
Thank you, sir. Dr. Rabbit, in your written statement, you said that your report found that veterans were less likely to access nutrition programs like SNAP, more so than non-veterans. In your opinion, what are the contributing factors to this disparity? I know you covered a little bit, but I'd like to go in depth on it. And you think it's a lack of knowledge of the programs? What is it with veterans that they just don't sign up for this or they don't use it?
Thank you, Ranking Member Moore, for your question. As a research economist at the Economic Research Service, our job is to anticipate trends and needs in data and to further the knowledge in this area. And so while we don't currently have any research specifically analyzing what might be the reasons that veterans are not uptaking the program, we certainly can work with that. As we get additional resources, we can move forward with that work.
So one of the things I've noticed when I was in the state legislature, we passed the Purple Hearts parking spaces for Alabama, and it reserved parking spaces for the Purple Heart. But then I will go to restaurants, and y'all, nobody uses the space. And I will look down and across the cars, and I'll see these Purple Heart tags, but none of the veterans, none of the people who earn that right to park there will use it. And so I wonder sometimes, I don't know how we communicate that, but the services are there for you to use. And it frustrates me when I go to these parking spaces, I see these restaurants, and you got this Purple Heart parking space that we put into law, and none of the veterans will use it because it's almost like pride for them. I mean, it's like they don't want to ask for help. And so that's always a concern for me. And this will be totally off track. Since you're at the USDA, and I serve on the Ag Committee, and there have been a lot of reports of processing plants burning and being destructed, some sort of attacks. I don't know. Are y'all seeing, it concerns me going down the road for food insecurity if these protein processing plants are being destroyed across our country. Are y'all tracking that at all? And that may not be in your wheelhouse, but it just has been in ours on the Ag Committee, and I thought I might put it out there since we're talking about food insecurity.
Sure. No, I appreciate your question. As a researcher, I'm not directly involved in that particular discussion or in that particular work. My area focuses solely on food insecurity, and particularly among veterans and active duty service members. But I'm happy to reach out to my colleagues at USDA and have them contact you about more information on that.
Yeah, please do, because I think that's a blip on the radar screen that maybe we're not paying attention to, but it's going to impact the food industry and certainly the veterans for food insecurity. And so that's one of the things I hope if you don't mind checking into it, I'd appreciate that. So with that, Mr. Chairman, I'm going to give you a couple minutes back for the time being.
Thanks, Ranking Member. Mr. Chairman.
Thank you, Chairman Levin. Dr. Going, I'll begin with you. Thank you for your testimony regarding the progress the Interagency Working Group on Food Insecurity has made over the last few years. Can you please discuss VA's relationship with the Department of Defense as it relates to food insecurity?
Thank you, Chairman Takano, for that question. Yes, we have been actively involved with the Joining Forces work group through the First Lady, specifically working on food insecurity, sharing with the DoD what we have done in the VA, how we've done our screenings, as well as how we've implemented a variety of different practices. So we have also made sure that there's information on food insecurity and nutrition in when you transition. So through the TAP program, when a transitioning soldier goes through the program, they're provided an enormous amount of information. Within that packet is information specifically on food insecurity, and the information also includes how to access SNAP. So it's not just VA services, it's how you can get services for if you're food insecure, independent, if you choose to come to VHA for your health care or not. So it is part of the welcome pack, and it's part of the transition through CAP.
Well, so the transition is what really concerns me, because I've been hearing some anecdotes from staff of reports, say in Europe, of inadequate housing plans, for example, that the DoD was not quite on top of that, and as a result, we had people really housing insecure, and so I mean. So that's what I'm trying to get at, this relationship between VA and DoD, and especially during this transition when the two agencies, these two big departments, kind of share a very important responsibility.
So again, I can't speak to the issue that you brought up regarding the transition in the ports in Europe, but again, we do work with them regularly, and one of the things we did do was to ensure that there was information on food insecurity, because that was not there in the past. So that is a recent change and something that we are very happy about, as well as the SNAP piece, because that was important, because as we know, not all veterans may choose to come to VHA, but we wanted to make sure that they all were provided that information and knew how to contact us and how to access resources, whether they use the VHA or not.
Okay. Defense, thank you. Defense Secretary Austin recently announced the department is, quote, all in on food insecurity, end quote. Does DoD provide warm handoffs to VA for service members who are experiencing or at risk of food insecurity during their transition out of military service to civilian life?
So thank you again for the question. I'd have to take that for the record. It's not something I'm completely familiar with, other than, as I had mentioned before, it is through the partnerships that we have, be it with DoD, USDA, that we meet on a regular basis and are regularly discussing and trying to develop different ways we can make these changes. But I'd have to take if there's a direct handoff for the record.
Yeah, what I'm getting at is I'm a little bit doubtful that just providing them information about SNAP is enough, that somehow DoD needs to look at this problem seriously, especially for the transitioning service members. There's a lot of stuff that can go wrong, and how do we ferret out the service members that are both housing insecure, that don't really have a plan? They've not, the commander of the commanding officer really has not, I mean, they got a lot on their minds, but has not really drilled down onto this issue. During VA solid start calls made in the period after a service member transitions, are veterans asked if they're experiencing food insecurity?
Again, thank you for the question. I need to confirm if it's happening in all questions. I know that we were involved in that, but I'd have to take that for the record to make sure it's part of the solid start questions.
Okay.
I can't answer that at this time.
Well, thank you. Well, it's important for us to understand how just providing information in a transition packet is really not getting at trying to ferret out and to discover and figure out who, because I can imagine a lot of folks out of pride not necessarily considering themselves to be food insecure. Anyway, I yield back, Mr. Chairman.
Well, I associate myself with those comments, Mr. Chairman. I think, just handing somebody a sheet of paper is not sufficient. Dr. Going, I wanted to go back to our subcommittee's legislative hearing in May, and there was something in particular that, frankly, was frustrating. My friend, Congresswoman Sarah Jacobs, asked a question regarding her draft bill to establish an Office of Food Insecurity at VA. And VA was not able to answer very basic questions that she asked. I think we all appreciate the work VA is doing to combat veteran hunger, truly trying to pave the way for the healthcare industry in its focus on social determinants of health. And that's why I think we were all confused why VA wouldn't support legislation to permanently codify an Office of Food Insecurity at VA. Committee staff, they're here. I know they worked really hard to draft this legislation with the input of hunger advocates and others. We're open to VA's feedback in terms of how to improve the bill, making sure it provides the flexibility that VA needs to make the office effective. But given the shared commitment, given the commitment of the administration, given the commitment of the Congress, given the commitment of the nonprofit community in ending veteran hunger, it feels like the time is now and that we ought to be making this a lasting priority by making an office dedicated to the issue permanent. So I'll ask again, how does VA plan to ensure that the existing Food Security Program Office will continue to operate in future administrations, even when priorities might shift?
So thank you, Chairman Levin, for the question. Well, VA is completely supportive of the intent of the proposal of legislation. The new office, we felt, needed the agility and flexibility outside of the legislation to be able to meet the true needs and respond quickly to the needs of our veterans. As you have seen, the Secretary has strongly supported this by approving the development of this office. And we're actually really excited about this since we are one of the few healthcare systems I'm aware of that actually has an office dedicated to food security. So again, it is through the partnerships, the data management, and the research that we are really excited about taking this to the next level, really looking at what makes the difference. And it's not just about, I often tell that story, we've all heard if you give a man a fish, you feed him for a day, and you teach him to fish, you feed him for a lifetime. That's what this office is about. We are not about just opening up food pantries and handing food to hungry veterans. It's the addition of the nutrition education. It's the fact that I myself am a dietitian, that Daniel is a dietitian sitting in front of you, that we've really connected to the nutrition security as a goal, because we are really looking to put these food pantries out there with nutrition staff available, so that when the veteran comes in, he or she is not just getting a bag of food, but that we actually can access their medical record because we have the electronic record, and then I can see that if I just give you a bag of food filled with cans of food, that actually might make you sick. That food is that's not going to be helpful to you. And it's the real intent of the idea that I mentioned earlier, that food is medicine. And that only happens when you have nutrition education linked with different food distribution. And those distributions are where our partners come into play. So
I agree, Doctor, with everything you said, 110%. I sincerely do. I guess the question that I have for you is, will you work with our outstanding staff who are here, who work really hard, who really want to get this right? Will you commit to working with them in the coming weeks and months to get this done so that we can get that legislation across the finish line and make this office permanent?
I welcome the opportunity to work with your staff, yes.
Okay, we're going to hold you to that. With the time I have, Mr. Santabanez, I wanted to shift gears. I want to hear more about, and I want everybody else to hear more about how the VA San Diego healthcare system is serving food insecure veterans in the area. What is the referral and follow-up process for veterans who screen positive for food insecurity?
Sure. Thank you for the question, and I welcome the opportunity to share what we do here at San Diego. So we, regardless whether it is the clinical reminder that is at the primary care level, we also expanded during COVID to increase hospitalized patient screening when we were having a hard time having veterans come in. But regardless whether it's through the screening or through our own comprehensive assessments, one thing that we do provide that's unique to our medical center is we do have a food empowerment program where we are able to provide a week's worth of non-perishable groceries to our veterans. We connect them with the community, so we work very closely with U.S. for Warriors, which is on the panel today, second panel. We work very closely with the county, and then we also have an embedded HSS Medi-Cal worker working for the VA that we can refer to help them submit the application for CalFresh. But we do provide a lot of individualized counseling as well, which is what's unique to the VA and where we work so closely with some of the food deliveries and other organizations in the community. So we're able to work with them. Most veterans that are food insecure, and most of our veterans here at San Diego tend to have depression, PTSD, or other mental health issues. They also tend to have a chronic disability such as chronic renal disease or diabetes, which really requires more than just access to food. It also requires education, counseling, and we're able to do that through multiple modalities, whether it's through face-to-face visit, whether it's through video to home conferencing, or even telephone appointments. For veterans with access, we can also do secure messaging. So we stay in contact with our veterans. We are available without need of a referral or a consult. And so we're always continuously trying to provide improved services. And we also work very closely with social work. We have an assigned case manager that updates through 211, and they update a resource guide bi-monthly of all the available food resources, and that's distributed among the dietitians, and it's also distributed among our primary care nurses. During COVID, we had an opportunity to expand the number of clinics that we can provide the food empowerment program, and so we also use that opportunity to expand training for primary care nurses so they can identify patients who may be food insecure but may not want to admit it or may not want to ask for the help.
Terrific. I'm going to stop you there because
thank you.
I want to make sure we get to our second panel, and I have one last question I want to ask here. In Dr. Rabbit, it's to you. There seems, and I mentioned this in my open, there seems to be a large gap between the data that you collected in your research and what the VA is saying that they're collecting in their clinical settings. You're a research economist, right? Yes, sir?
Yes, sir.
Yes. So as a research economist, how can you discuss why there are these discrepancies in the data related to food insecurity among veterans?
So we do speak to this in our report, and specifically we talk about, excuse me, a review of the literature where we find that in different settings there's been different estimates of the prevalence of food insecurity among veterans. And so there's many factors from a research perspective that could lead to this, primarily being individuals choosing to uptake benefits at these clinics. So that can affect their underlying behavior related to food insecurity. However, that's an open research question that could certainly be analyzed over time.
So could you expand on that and maybe speak to the prevalence of hunger among veterans who are enrolled or eligible for VA health care versus those who aren't?
At this time, we have not looked at that question in particular at USDA.
Okay, that might be good area for follow-up research, I would suggest, and whatever we have to do to effectuate that as the Committee of Jurisdiction, we will look into that. I'm going to end it there because we want to get to our second panel. Any further questions?
Just real quick, if you don't mind,
Please,
Mr. Chairman.
go right
Dr. Rabbit, I just want to ask a quick question. In your testimony, you stated that the report found that veterans living in rural areas are more likely to live in households with food insecurity. Now, why do you think that's the case? I have a lot of rural areas, and it concerns me when I hear this. And so, and also, what do you think we should do to help?
In terms of that particular question, we didn't specifically analyze why they're more likely to be food insecure. However, common economic reasons for why that might be occurring are going to be issues with access to the labor market, so there could be employment issues among rural households. In addition, they could face higher food prices and have greater difficulties accessing goods and services. In terms of addressing that issue, we would have to look into particular research designs to actually analyze that.
Thank you, Mr. Chairman. With that, I yield back.
Thank you. Mr. Chairman?
Thank you, Mr. Chairman. Dr. Rabbit, does the USDA Economic Research Service plan to include veterans in its annual food insecurity report this year?
We have discussed it. Currently, we have not added it to the annual report. However, we are adding it to other factors where there will be consistent tracking over time. In particular, it's going to be part of the Healthy People 2030 initiative with HHS, and we're providing those statistics.
I would strongly encourage the service to do that.
Sure.
Based on your research, to include it in the report, the food insecurity report. Based on your research, can you please discuss the demographics of those veterans most at risk of food insecurity?
Based on our research, it's the common expectations among households that are at risk for food insecurity in the U.S., households with disabilities. You're going to have individuals that have lower educational attainment. In addition, minority households, households with low income.
So those are the three big categories of people most at risk among our veteran population. It kind of mirrors what we see in the general population. How does the USDA connect those subpopulations who are most at risk for food insecurity to resources such as SNAP?
Well, with resources such as SNAP, it's designed to be a universally eligible program in the sense that anyone can apply for it that's income eligible. And so, as long as they have access to that program, that's a way to address food insecurity.
Yeah, I don't have much time, but I'm very curious if I could take if you could go back and think about this a little more. How in particular are we reaching these subpopulations? Are we doing anything special to reach them, the minority, the communities, the people with disabilities, et cetera?
Sure. I can reach out to my colleagues that are SNAP experts and have them contact your office about outreach efforts and different research in that perspective.
And finally, I'm really concerned about the finding mentioned in your report that women veterans are more likely to be food insecure than male veterans. Can you please discuss why this is the case?
We don't specifically look at the potential causes for why they're more likely to be food insecure. We do mention a potential reason is that they are at higher risk for work-limiting disabilities related to their service, so health effects of military service potentially, but we do not actually go into detail analyzing that question.
Well, so you really don't, do you have any suggestions about how VA and USDA can better serve women veterans? Since you don't really answer why, I'm not actually expecting an answer here, but.
As a research economist, what we do is we try to do our best to anticipate needs for data and research, and so I see our role as providing as much useful information as we can to policymakers and to our colleagues at VA and other organizations.
Well, great. Dr. Going, does VA track those veterans who go on to enroll in SNAP?
We do not track if they go on to enroll in SNAP.
Okay, so that could help explain this differential between VA's number and USDA's. If not, are there ways that VA and USDA could collaborate to track which veterans are accessing federal nutrition assistance resources?
We work, well, thank you for the question, Chairman Takano. We actually meet regularly with USDA, regular as monthly, and we're regularly looking at things. To your point regarding women, we actually, as recent as last month, had a specific meeting with all the WIC providers, since WIC is very specific to women and infants and children, to figure out ways we could better connect our female veterans to WIC programs. So it is something that we are regularly working on, so yes.
Well, that's what I was getting at as far as what are you doing specifically to reach these people. But I'm glad you are meeting. But I'm specifically interested in the VA and USDA tracking. So if you would get back to us after you kind of go back to your working groups, what are you doing to track which veterans are accessing federal nutrition assistance resources, and when a veteran's SNAP eligibility expires? Does VA check with the veteran to ensure they have continued access to stable nutrition resources? I mean, do you track that within VA in terms of when that veteran's SNAP eligibility expires? Does VA have a process, procedure by which they start to check with that veteran? Are you still?
Thank you for the question. So each veteran's care is individualized, so each veteran is going to be regularly meeting with their providers, be it their social worker or their primary care provider, or whomever they see on a regular basis. So checking in on those types of things happens on a regular basis. We do not track specifically for their food insecurity because we're meeting with them and tracking for a variety of things that impact their clinical outcomes. So we're going to be checking on whether they still have stable housing, still have those types of things. So it's individualized based on why the veteran is being seen and who they're being seen by. And that's actually the beauty of going back to the screener, because again, it's going to happen every year in that primary care clinic. So if they weren't spoken about it sooner, like in less than the 12 months prior, it will happen at least once a year. The question will be brought up.
All right. Well, before I yield back, I just want to say the one big thing I want to see come out of this hearing is understanding why VA is coming up with a 2% number versus the 9 or 10% or the 8% number coming out of USDA. I'm very, very concerned that we've got a lot more veterans that are experiencing food insecurity. Very concerned about that women veterans are experiencing it more than the male veterans, and that we have limited outreach, and that maybe USDA needs to up its game with everybody, but I need VA and USDA to work together to figure out how we're going to reach these very vulnerable groups of people. It's just not acceptable that we have anyone who wore the uniform of the United States experiencing food insecurity, especially if they're also disabled. That to me is just, I cannot countenance that, whether it's rural, urban, or anywhere. I yield back, Mr. Chairman.
Well, I thank the chairman for his comments, and I'd be remiss if I didn't ask a question of our friends from San Diego County, so I will make it along those lines. There's a piece of legislation called the Feed Hungry Veterans Act, which would hopefully allow more disabled veterans to be eligible for SNAP benefits. I'm a co-sponsor of that bill. Could you discuss the challenges that local veterans with disabilities here in San Diego County face in meeting the current requirements, the SNAP requirements, and how legislation like what we're proposing might help?
Sure. Thank you, Chairman Levin, for the question. So currently, for disabled veterans, they would have to be at 100% disability to be considered disabled and be exempt from any type of work requirement. So any legislation that could lower that bar for percentage of disability, age, or any type of pension would be extremely helpful to promote more enrollment into the program locally.
Terrific. Anything else you'd like to share with us before we switch to the second panel, just about the work that you're doing in San Diego County?
Well, we just really appreciate the opportunity to present and testify to you today, and we appreciate your support, so thank you very much.
Thank you. Well, we're grateful that you're all here, and with that we can call up our second panel. We'll take a minute here.
Great. No, it's great. It's great. It's great hearing. It's great hearing. Thank you. Great hearing.
Thank you. Thank you. Thank you. You out here? Is he out here? Okay, all right.
It's an issue for us, for sure.
Okay?
I got time on the rest.
Thank you all so much for joining us. On the second panel, we have Anahid Braki, Chief Executive Officer and President of the San Diego Hunger Coalition. Terrific to see you. Also joining us is Casey Castillo, Chief Executive Officer for the Jacobs Cushman San Diego Food Bank. Terrific to see you as well. We also have Carla Samayoa, Director of Safety Net Services at 211 San Diego. Welcome. And last but certainly not least is Anthony Tony Stewart, Chief Executive Officer of Us for Warriors. Thanks for being here. As you know, you're going to have 5 minutes for your oral statement, but your full written statement will be added to the record. Ms. Braki, I'll recognize you first for 5 minutes.
Thank you, Congressman Levin. Thank you, Chairman Takano and Ranking Member Moore. My name is Anahid Braki, and I'm the President and CEO of the San Diego Hunger Coalition. I'm also serving in my second year as the chair of our county's Social Services Advisory Board. The San Diego Hunger Coalition is a nonprofit organization that has worked for nearly 50 years to create a hunger-free San Diego. We lead coordinated action supported by research, education, and advocacy with hundreds of local partners crossing all of the sectors. We provide data and research on hunger issues and the hunger relief landscape, and our goal is nutrition security, which we define as having access to 3 healthy meals a day. We also manage the largest SNAP outreach grant contract in San Diego County with 18 different subcontracting agencies providing application assistance and outreach in San Diego County. We consider any household with income under 200% of the federal poverty level to be nutrition insecure. That is $27,000 for one person or $55,000 for a family of 4. San Diego County, as many of you know, is one of the most expensive regions in the nation, and the current rent for a studio is $2,400. So if you earn $15 an hour with our new minimum wage, that leaves you about $200 a month for food, gas, health care, and I didn't even take out taxes. I share this to illustrate that 200% of the federal poverty level is a way to conservatively estimate the need for food assistance. I also go into detail to emphasize that this is an economic and systemic issue and not one of personal failing. And when we continue to use parables about teaching a man to fish, when we're talking about our veterans, we continue to perpetuate the stigma and shame that does keep many veterans from applying. We all know that the COVID pandemic made food insecurity worse. Currently, with our definition of nutrition insecurity, we're looking at about 1 in 3, 1 in 4 people needing some kind of food assistance to be able to afford enough healthy food. During the COVID pandemic, our region increased the number of meals provided through food assistance by 85%. With my partners here and others throughout the region, it was incredible. Most of that, about 60% of that, came from SNAP. And that is thanks to being able to increase the enrollment, the emergency allotments, and the waivers that made it easier to enroll. Despite all of that response, we still have a monthly meal gap of over 13 million meals. If we want to provide enough nutrition for everyone, we have to fully utilize the SNAP program. In San Diego County, about 40% of eligible people are not enrolled. That's over 200,000 people. This disparity is much worse for veterans. You heard that about 2,700 individuals identifying as veterans reported using SNAP. That's somewhere between 9 and 16% of all vets. We have a few recommendations I would like to share. First, hands down, the best way to help veterans is to fix the safety net for all people. It's not just about outreach and handing people information. It's about what happens when they start that application and try to submit it and get through the enrollment process. It's undignified, it's overly complicated, and these are all things that can be fixed with federal legislation. We also recommend that you start to look at income, household income and household size, as well as asking the verbal screening, the 2-question screener or whatever you're using to determine food insecurity. Shame, the stigma keep many people from admitting that they're food insecure. And you can tell, we know how to measure the cost of living, and we know what the cost of food is, so you can really tell when you look at someone's income and household size, the status of their ability to meet basic needs. We also encourage that there be perhaps new programs for supporting and rehabilitating veterans who have been dishonorably discharged, so that they can also have the support to enroll in SNAP and other vital benefits. I look forward to your questions, and thank you for your time. This concludes my testimony.
Thank you, Ms. Brackey. Mr. Castillo, you're now recognized for 5 minutes.
Good morning, and thank you. First, I'd like to thank members of the subcommittee today for inviting the San Diego Food Bank to join this important discussion about a very serious problem facing our veteran community. I'd like to start out by briefly giving an overview of the food bank's work in the community and the impact of COVID on our service population. The food bank serves the entire county of San Diego. Prior to the pandemic, we were feeding 350,000 people per month. That skyrocketed to 600,000 at the height of the pandemic, and now we are currently serving 500,000 people per month on average. The food bank operates out of 2 locations. We have a 100,000 square foot warehouse in Miramar. That's the San Diego Food Bank facility. And we have a 70,000 square foot warehouse in Vista. That's our North County Food Bank facility. From our 2 warehouses, we supply food to 500 nonprofits that operate feeding programs across the county. These nonprofits include food pantries, soup kitchens, shelters, low-income daycare centers, senior centers, churches, schools, and care centers for the elderly and disabled. We also operate 200 direct distributions every month throughout the county. This is where our team will show up and distribute food directly to those in need. Tens of thousands of low-income, active-duty military service members and veterans rely on the San Diego Food Bank for food assistance. Prior to the pandemic, the food bank served 39,000 low-income military veterans and their dependents each month. Post-pandemic, we are currently now serving 45,000, an increase of 6,000 monthly. For many low-income military families, San Diego County's high cost of living makes it difficult to put nutritious food on the table. These families struggle with our region's high rent, gas, utilities, and food prices. Last year, the food bank distributed 4.5 million pounds of food to nonprofits that directly serve military personnel and veterans. We currently serve 18 nonprofits with programs solely supporting military personnel, veterans, and their dependents. Some of our partners include Assistance for Veterans, Military Outreach Ministry, San Diego Armed Services YMCA, Veterans Association of North County, Veteran Village of San Diego, Wounded Warrior Homes, Support the Enlisted Project, and the USO of San Diego. These nonprofits receive food from us in several ways. One, many come to our warehouse and pick up food in bulk and distribute the groceries at their on-site food pantries. 2, they will hold monthly food distributions in their parking lots. Our truck will show up and deliver between 8,000 to 14,000 pounds of food to be distributed to hundreds of those waiting in line. And finally, our mobile pantry filled with food will visit their location, and food bank staff will distribute the food directly to military families. The food we distribute typically includes fresh produce, dairy, canned meats, vegetables, and fruits. We also distribute frozen protein items such as chicken and beef, and we also distribute other items such as bread, cereal, and pasta. Our numbers demonstrate that food insecurity among active duty and veteran families is a serious yet hidden problem which has been exacerbated by the financial impacts of the COVID-19 pandemic and the current inflationary environment we find ourselves in. The food bank strongly advocates for measures that will improve the circumstances of veteran personnel and their dependents to ensure they have the resources needed to achieve financial and food security. Thank you.
Thank you, Mr. Castillo. Ms. Samayoa, you're now recognized for 5 minutes.
Thank you, Mr. Chairman. Thank you for the opportunity to testify at the House Committee on Veterans Affairs Subcommittee on Economic Opportunity hearing, Ending Veteran Hunger, Examining the Impact of COVID-19 on Food Insecurity. 211 San Diego is one of the nation's leading referral and information resource agencies, and for more than 15 years, we have been proud to serve the residents of San Diego. 211 San Diego is a nonprofit organization that is the region's trusted source for community health, social and disaster information, and for connection to resources and programs. As San Diego has a distinguished and rich military and veteran history, 211 is especially proud to pay close attention to the region's community of military, veteran, and their family and caretakers. Our organization is not only led by a U.S. Army veteran, President and CEO William York. We offer the Courage to Call program, an integrated program that is funded by the County of San Diego and operated by 211 San Diego, Mental Health Systems, and Veterans Village of San Diego. Courage to Call is a free, confidential helpline staffed by veterans and family members that provide 24/7 peer advocacy to military veterans, their families, and caretakers by providing navigational support to specific needs that impact this particular community. For more than 2 years now, 211 San Diego has been on the front lines of the region's response to the COVID-19 pandemic, serving more than 1 million people using 211 services. We have worked in partnership with our local and state governments, community organizations, corporate businesses, and philanthropic community to ensure that San Diegans have equitable access to testing and vaccinations, while also helping individuals and families connect to critical essential services and basic needs such as food resources, rental and housing support, and financial and health assistance. While COVID-19 elevated and shed a spotlight on many community gaps and needs, food insecurity has been one of the greatest impacts in our regions for decades. The pandemic has severely increased this issue, with many households experiencing food shortages that have driven them to food banks, food drives, and other resources. It's never been clearer than now that food insecurity has cut across all demographic lines of the diverse regions we serve, and has particularly impacted our friends and neighbors serving in the military and those who are veterans. Our knowledge and experience in this space, combined with our robust data and informatics systems, have captured the nutrition challenges posed by the pandemic. For example, at a national level, veterans experiencing serious mental illness have food insecurity rates 10 times higher than those without serious mental illness. And veterans who reported fair or poor health were about 3 times likely to be food insecure than those who reported to be in better health. Additionally, studies consistently find higher rates of food insecurity among certain subgroups of veterans, including Black, Latinx, and other non-white veterans. This is according to the Center for Strategic and International Studies. Here in San Diego, we have seen low CalFresh application submitted numbers compared to those who are likely eligible but not participating in the program. Sorry, I lost my space here. The year prior to the pandemic, 201 San Diego completed almost 14,000 CalFresh or SNAP applications. Of those, 1,113 were for veteran households, about 8%. During the COVID-19 pandemic, 211 San Diego submitted over 28,000 SNAP applications. Of those, over 3,000 applications were for veteran households, representing 10% of submitted applications. Mental Health Systems Courage to Call programs, in whom we partner with and refer to, has been facilitating food distributions to active military and veterans in partnership with Feeding San Diego since 2017, and it has served over 11,000 households between 2017 and 2021. Our frontline staff have reported that many callers seeking assistance through our Courage to Call program do not know about CalFresh or report misinformation regarding eligibility, such as not wanting to take the benefits from someone else. Misinformation may be a reason why there are less eligible veterans households participating in these programs. Our data indicates that 32% of veteran callers were not knowledgeable at all of the food assistance programs or nutrition resources in the community, and 53% of clients skipped a meal or ate less because there wasn't enough money for food. Increased information of available food resources upstream may help to ensure that veterans know that such resources exist. Another factor that contributes to food insecurity among veterans is low household income. According to Blue Star Families, prior to the pandemic, unemployment rates among military spouses was 24%. Additionally, 42% of military spouses who had been employed prior to the pandemic reported that they stopped working after March 2020, largely due to layoffs. At 201 San Diego, data indicates that of veterans who called between March 13, 2020 and August 31st of 2021, 31% reported being disabled and unable to work. 32% reported being unemployed, and 24% reported not being in the labor force or retired. Of these clients, 73% reported being at 30% or less of the area median income. 83% of our veteran callers reported not having enough money to buy food. 211 San Diego requests that the House Committee of Veteran Affairs support our recommendations to increase access to important food resources and awareness of available programs to the military community in a way that is upstream and stigma-free by funding existing agencies providing these services to expand capacity. Again, thank you to the committee for its efforts to address this critical issue. 211 San Diego stands ready to assist our courageous veterans. Thank you.
Thank you, Ms. Samayoa. Mr. Stewart, you're now recognized for 5 minutes.
Thank you, Chairman Levin, Chairman Takano, and Ranking Member Moore. Thank you for inviting me today to testify. I'm Tony Stewart, Chief Executive Officer and co-founder of the Us for Warriors Foundation, a nonprofit veteran support organization serving San Diego County area. Through our small, hardworking staff, adaptive programs, and a warrior volunteer force, Us for Warriors has supported thousands of warriors and family members to improve their quality of life. Roughly 18 million veterans live in the United States. Us for Warriors supports an area of veterans, active duty military, and families totaling 1.2 million. As the single means for producing veterans is through service in the armed forces, it's equally important to remain on the pulse of the needs of the military as they become veterans and grow families along the way. In 2018, the VA estimated 200,000 men and women leave military service and become veterans each year. Challenges of our military families today have a high probability to carry to post-service time tomorrow. Pre-pandemic, 10.5% of the overall population was food insecure, with studies concluding veterans' hunger to be nearly twice that of the general population. Recent studies conclude food insecurity 22.5% higher among disabled working age veterans than other disabled veterans or disabled workers. Coupled with mental health challenges, veterans experiencing serious mental illness have a 10 times higher rate of food insecurity than the general population. As more studies aim to quantify the problem, the statistics show the challenge is well worth our effort. For those living with food insecurity, the uncertainty of having enough or the ability to meet the needs of their families brings them to organizations like Us for Warriors. Since 2016, our food drop distributions have become a reliable source for veteran families. We were thankful that our monthly distribution model with outdoor remote locations, prepackaged groceries, and drive-through staging easily adapted to the needs of the pandemic. Our Care for Warriors boxes for homeless veterans became more important, as well as our Safe Pantry pickups hosted each weekday. We also maintained delivery of food to our partners at the VA San Diego Healthcare Food Empowerment Program and participating clinics. Overall economic uncertainty adds to the challenge. Staggering gas prices, transformation of the job market with shuttered businesses, and changes to the way we work. Limitations that come from COVID as now a part of life, and other challenges means the struggle continues. With most statistics from pre-pandemic figures, capturing the hardships faced by veterans and their families is still catching up. However, we see all these economic pressure points limiting the quality of life of our veterans' communities, and we see it each day. Having many options to be where veterans need us is important, as they find themselves facing choices between going hungry or being able to afford the gas to drive to one of the food locations available, or affording food while maneuvering through a challenging job market. We're grateful for the guidance and support of our partners at Feeding San Diego and San Diego Food Bank, especially during the pandemic. Also, the support of the American Legion, the Veterans of Foreign Wars, and the Benevolent Protective Order of Elks, who gave us venues for distributions and didn't skip a beat during the pandemic. We're very thankful to the San Diego Veterans Coalition. The economic adage of a rising tide lifts all boats is special to Us for Warriors, as we believe this general truth can also be applied to any problem, any group, any time, and anywhere to help in every way. The San Diego Veterans Coalition is a strong source for these collaborative efforts, and veterans' hunger truly demands cooperation and a steady course forward. Those veterans who've already made significant sacrifices in their lives deserve all that we can give them. One prevalent request is to consider reducing barriers to USDA's SNAP enrollment for veterans and to review overall eligibility for both veterans and the next wave in the military to help remove barriers to participation for those who truly need the services today and tomorrow. After the reach of COVID fades and the economic damage control measures expire, there will still be hunger, unfortunately. Usda Warriors is committed to work with our partners to seek ways to help to eradicate that hunger among the veterans community. Thank you for this opportunity to contribute today, and I'm available for questions.
Thank you so much, Mr. Stewart. Thank you to all of our witnesses. I'll now recognize myself to begin the question portion of the hearing, and just want to thank you all for the tremendous work that you've been doing in the community, particularly during the last couple of years. I remember visiting the Vista Distribution Center for the food bank with my wife, and there were people in line to receive food who used to volunteer at the food bank, never believed in a million years that they'd need the food themselves. But the pandemic is, particularly in the early stages of the pandemic, it just really did mean that all of you had to go above and beyond, and that, of course, included all the work that you've been doing for our veterans. So truly grateful for that. Ms. Brackey, as you heard on our first panel, VA, I think you heard on our first panel, that VA recently updated the clinical screening tool for food insecurity from 1 question to 2. Also, I'd be remiss if I didn't thank our friends from VA and from USDA for sticking around. Even though you all came out for this, you'd be amazed. Sometimes the folks from our agencies do not stay for the second panel with our VSOs and with our community organizations. Personally drives me nuts. So I'm grateful that y'all are still here. But again, from 1 question to 2 for the clinical screening tool. Can you discuss the importance of how screening tools are formulated to ensure that they're accurately and adequately capturing those at risk of or experiencing hunger? And do you have any recommendations for how VA could further improve the screening tool?
Thank you, Chairman Levin. I will just reiterate my recommendation that you also look at household income and household size, and look at the household income, because that will tell you whether or not the household has enough money to make ends meet. When a family doesn't have enough money to make ends meet, they're making those trade-offs that some of my colleagues were talking about. The screener is highly effective, but the shame and the stigma and the fear of admitting that you can't provide enough food for your family keeps a lot of people from responding. So the recommendation is to combine both.
Got it. And as we look to identify ways to further engage veterans and their families in accessing available nutrition assistance programs like CalFresh, what other recommendations or best practices do you want to share with the committee?
The process is, hunger relief program, the hunger relief sector in general doesn't really work as well as it should. It's very easy for people to fall through the cracks. We have created something that we call the Hunger Free Navigator training, which is a 90-minute training, and it teaches people how to effectively refer and connect people to food assistance. So that kind of a training of all VA frontline staff would be especially beneficial, I think.
And are there any specific barriers that you believe prevent the veteran population specifically from getting food?
I think that they're probably the most, as was mentioned earlier, the most proud and the most ashamed. When our national level rhetoric continues to look at SNAP as, a bunch of freeloaders, how do we expect our veterans to go with pride and ask for help?
Mm-hmm. Thank you for that. Mr. Castillo, I'll turn to you. Many federal relief measures were instituted throughout the pandemic to help alleviate the hardship on families across the country, including an increase in SNAP benefits. Did the San Diego Food Bank see any changes in demand for its services and resources when these relief measures were in place and when some of those relief measures expired?
So yes, we did see a large increase, doubling in many cases for both food and SNAP benefits. Last year, we just closed our fiscal year on 6/30. The year before that, which captured most of COVID, we distributed 60 million pounds of food. This past year, we distributed 50 million. So a large part of that is the that we've exhausted federal funds that we received because of COVID. So we did see a decrease within the last 12 months because of that.
Thanks for that answer. Mr. Stewart, I'll turn to you. Is it possible for you to give us a rough estimate of how many veterans Us for Warriors serves that are not connected to VA healthcare or benefits?
Thank you for the question. trying to run the statistics in my head right now.
Roughly.
So we're a small organization. We roughly take care of about 5,000 a year. And I would say that with the VA program, it's more targeted, and it's I would say about 100 or a couple hundred a year on that.
What kind of difference in outcomes, especially as it relates to hunger, do you see for veterans who are connected to VA resources?
I wish that they would be connected more, and we try our best because one thing, we talk about stigma, and it is there, and we talk about pride and all the things associated with service. I've 20 years in the military. On top of that, 13 working for the government associated with the military. I've seen it all the time. It's very hard to ask for help. When you go to the VA, you're not going there for food insecurity. You're going there because you have a condition, and you're going there because you have something that you are getting service. So sometimes food, I had to ask myself, food was secondary to the reason why I go to the VA for care. But working with the Food Empowerment Program since 2017, when everything first started, I share with you that even though they were not full-time dedicated employees, just for the scope of that, couldn't find a more compassionate group that dedicated of their own time to be part of the Food Empowerment Program in order to make sure that the word gets out and all the things in place. I was excited to hear about having more coming to the table for that. Hope that answers.
Yeah, no, fantastic, and it's really encouraging to hear that. I just have a few more questions. I'm going to power through these. Ms. Samayoa, I was really heartened by your testimony regarding the Courage to Call campaign, the program that 211 San Diego operates to help military and veteran families navigate the care network in our community. You mentioned that many who use Courage to Call are not aware of the existence or eligibility for nutrition assistance. Do you have any suggestions for how federal and local agencies can better ensure that our veterans have access to this information?
Yes, thank you for that question. I think from our experience, more proactive messaging campaigns upstream, and even thinking about different ways of doing handoffs with folks that might be vulnerable. We found that to be effective with certain vulnerable populations rather than pumping out a bunch of messaging and hoping something sticks. Having some sort of partnerships where there's some direct handoffs with people that we know could use help so that there's community of agencies that could partner and support that person with whatever resources they need. So my recommendation is not only more messaging and more education to get the word out about the different programs that exist, but looking at different partnerships and abilities of using technology of connecting people proactively.
What recommendations would you have around the stigma associated with these programs? I've heard this from a number of people. Any thoughts on what we need to be doing to address that?
That's a tough question because I think that's part of a broader, narrative. But I think educating people on the power of food benefits, on how food is health, showing people, how CalFresh could stretch your food budget, your grocery budget, and your, household budget, I think is really important. And then having these kind of checkpoints at different places like the VA, like in hospitals, like in other settings. So it's like a familiar resource and it doesn't seem as so that we could help destigmatize that.
And Ms. Brackey, I'll close with you. I have a 10-year-old and an 8-year-old at home, and they attend our local public school district. And what I saw during the pandemic was just a remarkable number of kids that didn't have enough to eat. For many, that meal that they got at school was the best meal. I knew theoretically that problem was a huge problem, but to actually see it and experience it and then walk through our school districts here in the community and understand the magnitude was really striking. And the data that you quoted in your testimony related to child hunger at military installations was just heartbreaking. I really appreciated your support for the Stop Child Hunger Act. That's a bill that I introduced to make the summer EBT program permanent, and also my Military Dependents School Meal Eligibility Act, which would allow military dependents to be directly certified for free meals at school. These are important bills that we've introduced. Can you please discuss the unique circumstances that military families face while serving that limit their access to nutrition assistance, and how these issues can continue on as a service member transitions out of the military and into civilian life?
Well, I'll start with the access issue in military. Again, we need to look at what is making people reluctant to seek help while they're enlisted. But then we also know in an area like San Diego County, with such expensive rents as we discussed and the very high basic allowance for housing, that basic allowance for housing increase puts them out of SNAP eligibility range.
Yeah. Thank
And
you.
I might,
go ahead.
but
Please proceed.
I think that's excluding the basic allowance for housing from the SNAP eligibility is a great first step. It's a great intermediate aid, but the ultimate issue of paying our service members enough to make ends meet is the real underlying issue to fix. Mm-hmm. And I do want to applaud you for your support of pandemic EBT. We saw how successful that was, and we know that the summer service programs don't work for today's families, and so summer EBT, we continue to advocate and support and thank you for your support of that legislation.
You have it. Well, we're all in to get that across the finish line, and I do know with our National Defense Authorization Act that we're going to be going back to Washington to hopefully pass this week. We are going to be advocating for a raise for our active duty men and women, I believe 4.1%, which it's not enough, but it is a step in the right direction. So with that, thank you for your patience. I thank the ranking member for his working with me on this, so we'll get through all our questions.
You are the chair, sir. They were informing me just now, Ms. Brackey, that the Ag Committee can exempt the SNAP, so that'll be on us now. We'll have to figure that out when we get back to D.C., but thank you, guys. I appreciate the participation, obviously. And so, Mr. Castillo, I want to ask you a question. You mentioned in your testimony that your organization often deals with junior ranking service members and low-income veterans families. Interesting, I was out, my brother he transitioned to F-18s to Miramar, and we were here one night, and there was a young enlisted Marine delivering pizzas. He came to the door, so he was working 2 jobs trying to make ends meet. Because I know the Marine Corps, that's a pretty tough job, right? And so this kid young, I don't know how old he was, but he was working all day in the Marine Corps and then delivering. I just found that amazing, because at Fort Rucker you didn't have that, because we don't have that cost of living issue in Alabama. So basically what you make, you can survive, right? So can you please elaborate on how the high cost of living in this region continues to impact these groups? I'm just curious more about that.
Yeah, I'd add not only the high cost of living, but also the unemployment rates that you see in military spouses, I think is adding to that. As we mentioned earlier, I wanted to add, the food bank has a Food for Kids backpack program. We support about 3,600 children each year on this program where they receive food over the weekends. We are on multiple bases and support several schools, military schools, with this program. We're going to approach 4,000 children next year. So huge problem within military is the food insecurity for
So
children.
a follow-up. You say the spouse's unemployment levels. Why is that? I'm like, in Alabama, we passed the law, so licensed reciprocity. So if you were stationed at Fort Benning, your wife was a hairdresser,
Yeah.
and she transitioned to Alabama. If she didn't have a license to cut hair in Alabama, she couldn't make a living. And Uncle Sam don't poll you when they move you. They say, hey, you're going to Fort Rucker from Fort Benning, right? And so I wonder sometimes, do y'all have that sort of law in California, do you know, Mr. Chairman, where you can get a license reciprocity waiver for spouses? Don't have that.
No.
So that would be helpful, because it was such a good bill for us. And what happened now, these, other than medical professionals, these spouses that taught schools, certificates, whatever it was, we could actually allow that wife or spouse, husband, whatever, to come in Alabama and go straight to work. So there you go, Mr. Chairman. I'll take care of the ag snap issue if you'll take care of the licensing issue for California. But anyway, so, and Ms., is it Samoa? Samoa. Okay. So it's a southern thing with us. You know, we don't get a lot of that. Can you tell me a little bit about how disinformation or lack of outreach can be a reason for veterans not seeking access to SNAP benefits? And I know we've covered that a little bit. I know there's a stigma, right? But anything else as far as outreach? You think, and when you say higher up, what do you mean? Like it needs to come from higher up the food chain?
What I mean by that is, maybe working with the VA closely so that if there are folks who are screened positive for food insecurity, I understand that the services that the VA provides is very crucial, but also connecting them to social services within the community so that there's wraparound support for that individual is critical. But in terms of misinformation or not having enough information, I think that could also be upstream, like when folks are transitioning from active duty to veteran life, like different services that might be available to them if they need them, and helping maybe destigmatize at that point as well. But I think more outreach, I think with the pandemic, outreach has been very different. We're not able to be, or we haven't been out in the streets as much as we'd like to, but I think reviving that and just making sure that folks are aware of the different services available to them, helping destigmatize and helping streamline access to that, because I think we've discussed that quite a bit here.
Ms. Stewart, you mentioned barriers to SNAP. What do you mean when you say barriers to SNAP?
So much of that's already been discussed. Say, for example, the military and the basic allowance for housing, classified as income.
So that's one of the barriers you're
That's
talking
one of
about.
the barriers right there. The lengthy process in itself is a barrier, so those are some of your basic barriers
Sure.
to the process itself. I think it just needs refining. It's great that you're going to take on that piece, because I think it's long overdue.
Please don't put that out publicly, but I just know
Well,
now that it's in my lap up here. That that's an ag, sir. You got to take care of that.
I think it's all recorded, right?
So,
But,
yeah, thanks a lot. I
exactly.
appreciate that, right?
But so that's very, very important from that. And if I may, we talk about the getting the word out.
Right.
I think that we need to focus on how to get the word out, because the world is a different place than the days when a brochure would tell it all.
Yeah.
Okay, there's many other places that we can communicate with our men and women in the veterans community and those that are in the next wave in the military, to give them enough compassionate narrative that they can hear it and realize that it is not a surrender. Mm-hmm. Because that's the thing about this is, when you have those situations, you serve your country for many years, and you reach a point where you got it all together at a particular time, and then life changes, and then at that you don't have the safety net, and how are we going to do this? And it's very difficult to maneuver through those waters, and that's why you see other things with this, right? Homelessness,
desperation,
suicide. Mm-hmm. You see all those different things that come, and it's compounded by these issues.
Gotcha. Mr. Chairman, I actually went over my time for the first time ever.
You
So I'll yield back.
You keep going. No, I'm very grateful to my friend, the ranking member, and if there are no further questions, we can begin to bring this hearing to a close. I want to thank you have a closing comment? Please.
A couple of other barriers. People think they're taking food away from other people when they enroll in SNAP. It's a huge misnomer. We have to also look at the SNAP process, which is it is oriented toward fraud prevention so heavily that that's what makes it so discouraging. And start to hold SNAP counties and states accountable for their utilization rate, because what gets measured gets done.
Mm-hmm.
Thank you.
Thank you so much. Thank you so much. I really want to thank all of our witnesses for their tremendous work for our community, for their dedication particularly their dedication to our veterans. And I want to thank, our friends from VA, from USDA, from the county, for all that they're doing each and every day, often without recognition or appreciation. Just know that your work really is making a terrific difference in the community. We're grateful to keep partnering with you. I also want to thank the staff of the House Veterans Affairs Committee, both the majority and the minority staff, for working together, for all the blocking and tackling that goes into putting a field hearing together. I want to thank my personal staff as well. They're in the back and in the back there, for all their great work for our veterans in the community, all the casework and everything else that they're doing each and every day to make a difference. You know, there are a lot of things in Congress, when you see and hear about them, you shake your head and you don't see people working together. You don't see the kind of bipartisanship that we need to actually advance good public policy. And if you take nothing else from this hearing, I hope you all know that when it comes to the House Veterans Affairs Committee, and particularly this subcommittee, we're doing everything we know to do to try to advance good public policy on behalf of our veterans in a bipartisan way. It's only possible with the cooperation from both sides of the aisle, and you know, I was very honored to have the ranking member come join me in beautiful Oceanside today. I'm going to be equally honored to be visiting him in Alabama, I think in 2 weeks from today.
Yes, sir.
Is that right?
So. Think so.
So I'm excited to do that, and I wish there were more of that in the Congress, but we're going to do everything we can here. Any closing remarks?
Yeah, and let me follow up with that. Talk about bipartisan. This committee, guys, I'm a freshman Republican from Alabama, a really red state, right? And I passed a bill into law this year because of the support of the leadership. And that's unusual for a freshman, kind of said a red state, but it was a great bill for veterans. And so it's certainly an honor to see that. You don't see that in D.C. very often, but this committee and we try to work together on veterans. We don't agree to the solutions all the time. We have different approaches, but I think our end result, our goals are the same. And so it's an honor to be a part of this, sir. Thank you for inviting me out. Thank y'all.
Thank you. Well, again, thank our witnesses. All members will have 5 legislative days to revise and extend their remarks and include additional materials. Without objection, the subcommittee stands adjourned.